And Doc, is this kidney issue predominantly in black race?
Well, it depends the cause. I mean, generally speaking, being diagnosed much later in life with chronic kidney disease is more common in our black population.
Okay.
Purely because of the late diagnosis of conditions like hypertension, diabetes, our over-the-counter self-medication use. These are and repeated infections. So these are just to name a few things why it may well seem like it's more dominant in our black race. Because if you compare to the white people, they have their health system set. There is a time when you're called, invited to come for your checkup, which they would go to. But our black people, well, fortunately, we don't do that. You know, often by the time one is diagnosed with type 2 diabetes, it's much at a later stage when the damage has been done to the eyes, to the kidneys, to the peripheral nerves. So that may well be why it may seem like it's more common in black people.
Oh, okay, because we don't manage
diagnosed
the
We don't know
late.
early.
Yes, the late diagnosis.
So assuming a woman knows that she has kidney issues, is it advisable to get pregnant?
Yeah.
Yeah. If you know that you have it, then that's the start. Then proper care. You have more tailored antenatal care, checking the pregnant lady's blood pressure, making sure it's optimum. Each time you go for your antenatal care, you ask for a urine sample, checking for the level of protein in the urine. So with proper care, yes, even with CKD, the lady can have
Even
pregnancy.
post-transplant.
Yes, even after transplant,
But what are the risk factors?
Well, life is risky as it is anyway. So there's no big deal about that.
Unmanaged is the risk.
Thank you. So
Not
it's
managed.
when you don't manage it.
Yeah.
But when you know, then you manage it correctly. You get on with, and the ethos here is more leading your life as near normal as possible with appropriate support. So it's managing it properly, and you get on with life.
I know we have discussed it earlier about the symptoms, but this moment, can we just list the symptoms of this so that, because we said it earlier while discussing other things, but at this particular moment, can we just focus on the symptoms so that our audience will definitely understand what the symptoms are?
I don't know what you're going to call these are the symptoms of chronic liver kidney failure. Those symptoms you're looking for will show their head a lot later.
At a later stage, isn't it?
Oh,
It's
Absolutely.
symptomatic.
If you're having those symptoms, you've gone
It's
down the
late.
path a
It's
lot.
too late.
It's too late. So it is from the very beginning, regular checks with your local doctor, family doctor, whatever you go to visit. It's actually important to at least see your doctor, have an overview once a year. Just have a feel of what's happening to you. Because some of these things creep in insidiously and you don't know. And if you don't know, it progresses. And when it progresses, that is when those symptoms you're talking about begins to manifest. And what are they? Tiredness. Yes, the sun is harsh. We do a lot of leg days. You walk up and down the whole place, and it's usually put down to that.
Yeah.
High blood pressure is another. If you're having symptoms from hypertension, you're down the path, because it's just one of those silent things. You don't know. You have headache, you can take Panadol, or you take Brufen. You take too much Brufen, it knocks on your kidney. So it's a vicious circle, and one cannot emphasize enough the need to have regular checks, be it blood pressure, be it ordinary urine dip, assuming you don't want to pay for the blood test. But it would be nice to have it once a year. because it will tell you so many things.
Yeah.
Blood sugar to be included, your kidney function to be included, your liver function to be included, as well as a blood count. Africa is blessed with our sun. We don't need to be eating woeful chicken ourselves. We have proper sun and vegetables.
Yeah.
What Oyibo will call organic. You have vegetables, loads of it. We have a lot of fruits.
And that is why we have them there. Just to let you understand, vegetarian.
We have a lot of fruits. We are really rich in such things. Nuts. These granules you have in your container.
Yeah.
Most of us here, we go home, we buy it and bring it back
Yeah.
here. Those nuts,
Cashew
rich in fiber. Cashew nuts. Sour or what?
Sour.
Sour shop, that's the word. Sour shop. Coconut. Pineapple. Ube.
Chai.
Oka.
Chai.
Where do I start? Where do I end?
Oh my God.
Ugu, that most people will have an orchard behind their house.
Yeah.
You're cooking.
Just go.
So those things, please, let's not put so much effort on meat and fish. Because you get the same nutrients from them as well.
On the vegetables, yeah.
But we have to exercise. We've talked about that in the diabetes talk. Exercise. Please, if you're going from point A to point B, walk down the road. Because you're exercising without realizing you're doing it.
It's very too sunny.
It is too sunny, go with your brolly. That's fair
I don't
enough.
have a brolly.
I know our people like dancing and we go for all these local things. It's a form of exercise. It's sunny, you sweat, and it's good for you. But more importantly is to have that review once in a while. For my fellow professionals, it's a plea. If you're giving somebody a medication, even if you don't know the side effects, please do Dr. Google. You can Google it up and see what the side effects are. And find out from your patient what other medications they are taking. Because there might be that interaction that can cause further adverse effects. So it's multifactorial.
Yeah.
And it's just a case of not just the patients, but the professionals have to change their outlook towards things. So it's a bit difficult to say these are the symptoms, because if you're having those symptoms, it's too late in the day.
That's, oh my God.
If you want to know more about the symptoms, she's mentioned some for you.
Yeah.
She's mentioned the tiredness, headache, muscle aches and pains, swelling. Yeah, we mentioned that. Itching.
Okay, itching.
Yeah.
Oh, this one that is itching
all over. We're not just talking about this bit is only itching one place. No. Because you're talking about kidneys, it's got to be widespread. So you're itching all over.
Wow.
You're itching all over, and there is no rash on your skin, but yet you feel itchy all over. Loss of appetite, maybe feeling sick all the time. You feel sick. So these are the symptoms that could indicate something not that's off balance within your system.
And when we say, and there is something I remembered now, kidney stone.
Kidney stone.
What is kidney stone? And that one is also a kidney disease, right?
Not necessarily, no, not necessarily, but it can lead to acute kidney injury.
Okay.
Yeah, which then, if that acute kidney injury isn't managed properly, can then lead to kidney disease. Now, kidney stone, we can form stone anywhere in the body. Some people might form more often than others. Stone is basically accumulation of these salts within the body. Salts within the body. Yeah, salts within the body, and then it accumulates and becomes hardened and forms a stone. And that can be within the kidney. It can be within the glands, the salivary glands. It can be in the joints, the gout. So stone can form anywhere within the body. And yes, it will be formed with different elements of the essential salts within the body. But if stone is usually painful because it's within a narrow space and it's causing pressure within that part of the body where it's formed. Say for example, you form a stone in your salivary gland. You're eating your food and the stone is causing the blockage. Your saliva is not draining. It's being accumulated within that gland. It causes it to expand. That would be painful. Or you have a stone in your joint, in your knee, for example. It will be painful because that stone is not meant to be there. And then you have a stone in the kidney, usually it will be painful. Because imagine the stone moving, being pushed along with the urine as it's being filtered. It's usually painful. Where then you need lots of drinks. So hopefully, if it's small enough, when you compare the size of the stone to the tube, then you may be able to pass it naturally by drinking plenty. But sometimes you need medical help to break it up. To break it up, so that then you pass little bits of it. Or if it's that massive, then yes, surgery to fish it out.
Because I remember when we were in Italy, one of our friends had that kidney stone. So he had surgery. When they removed it, it was at the side.
Some of them can be that big, and then need surgery to remove
He
it.
kept it. He kept it for us.
It's very painful.
Very painful.
It's painful, very, very painful. That's different.
But can it lead to death?
To kidney failure?
No, death. Can someone die because of kidney stone? Or it might lead
well, if it's that big and then it causes rupture, and then you bleed,
sepsis and bleeding and all whatnot. Anything can cause death. It depends on the aftermath.
Wow. And look, this reminds me of what you said earlier in Nigeria, because 80% of our people, even the youth, have high blood pressure. 80% have high blood pressure. Some are taking medication, some do not know. And those that are taking medication, they are not even going checkups to find out the complications, whether that medication they are taking is causing another issue in their system. Unlike here, those that are taking high blood pressure medication always go on regular checkups, blood tests, and to make sure that everything is in order inside there. But in Nigeria, they don't. They are taking, but they are not doing.
There's always this belief that if you're taking a treatment, that is your answer. No, it's not. You initiate an intervention. You'll see if that intervention is working. You maximize the dose. If you maximize the dose and it's not giving the desired effect, you add on. So, but back home, because everything is your power driven, it's just like, oh, Dr. Onyiremo will BP. That's not to say it's doing what it's doing. It might not on its own. You get to the maximum dose. You have to add another thing, and you may have to add further. And we cannot emphasize enough the importance of checkups, because it's only when you go for those regular checkups that you can figure out, is it controlling my blood pressure or not. Like, you're just popping that pill every day doesn't necessarily mean it's controlling the blood pressure for you. It's not. So it's a behavior change for people to move towards regular checkups. It's the answer to most things, actually. Regular checkups, and doctors being honest as well. Don't see any opportunity as an opportunity to make money.
I mean, when we say regular checkup, initially you may need to go more often, because at the very start of diagnosing the problem and starting the treatment, that review needs to be a bit more frequent, maybe say monthly to start with. But once you get to a steady level where you feel, okay, this is stable, then it's advisable once a year. It's good enough to have that review. You go for the blood test, which will include looking at the kidney function, looking at the liver function, looking at your blood sugar. Is the person developing diabetes? And checking the blood pressure. That's really as simple as it is.
As simple as it is, actually.
And then every other thing would be based on what information you gather from that review.
Wow. in Italy, our GP, I remembered when I visited my GP, I was complaining of backache. So he told me that backache, sometimes if I need to check if it is a kidney issue, I should hit. And this doesn't work. If I hit, I will feel that type of pain. Then
if it's pyelonephritis, you're checking for lumbar angle tenderness.
lumbar.
But that's in addition to other findings. So it's not just hitting and being tender around the lumbar area. It will make you think more about pyelonephritis, but it's in association with other things.
Yeah. Oh, you hit me like this. Pam, 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 pam. Are you feeling anything?
Yeah, because that's where your kidneys
That's what
are.
the kidneys are.
So if you hit and the pain you're feeling, you would know it's not going to be coming from just your back.
Yeah.
It's more inside.
That's what he said.
Yes.
So if I should tell him, I say, I'm not
Similar
feeling
to if you have appendicitis, you press
Yes,
there,
yeah, right.
appendix, and you don't want to move, because if you move, the appendix moves and it's painful. So it's that sort of. So hopefully somebody that's had appendicitis would then know what to look out for kidney infection.
Oh, wow. We have enough information about kidney disease.
I mean, it's broad. I'm no specialist, but this is just a basic knowledge. But then if you're talking about, once you find out somebody have got kidney disease and you think it's that more severe level, then you do need somebody more specialized in kidneys.
And I think, Doc, we have a specialist in kidney who, right, maybe after this COVID issue, we might invite him to have a discussion.
Yep. He's a trained nephrologist, and yes, he'll be very happy to be part of it.
Yeah, it is really interesting, and I'm sure people will be amazed. We have a lot of information given to them about kidney disease and kidney failure. The CKD. Okay, CKD. Alright, CKD. Chronic kidney disease. That is very, very important. The good thing is these are kind of illness. That is the kind of diseases that can be managed. We don't need to be afraid of them. The most important thing is finding out early. If it is diagnosed early, then proper management will at least help out. We don't need to be very, very afraid or think that if you go and they declare that you have kidney issue, high blood pressure, diabetes, it's a death sentence. No, all these things can be managed. All these kind of diseases can be managed. So don't be afraid. Let us do the things we can do and leave other things in the hands of God. By eating good food, and God blessed us, and that is why God blessed us with good natural food, because He knows that we will have issues with our leaders. So we have those good things that we will use, and they don't cost too much. Rather than spending, our amazing doctor said it here, rather than spending huge amount of money on Wivon, they said the other one they call it, is it I don't know what, I don't even know the names. Let me not, So you spending 300,000 naira to buy Wivon, you spend 200,000 naira to, nobody said that you shouldn't look smart, because I like people looking smart, but you don't need to spend too much to look smart in that way, dying of headache or a slight illness, thinking that, you don't have money, but you have that money to spend on Wivon, on clothes, and painting your nails. Yes, it's good to look smart. Look smart, take good care of your health. Health is very, very important. If you are healthy, you are wealthy. If you are healthy, you are smart.
Correct.
So Doc, what else can we add in this discussion about kidney and problems, complications, and
On top of regular checks, regular reviews, doctors, please tell people what you're giving them. Consider the interactions, because you might end up with undesired effects that you didn't plan for. So consider that is for professionals. Consider the undesired effects, the side effects, interactions, the longevity of treatments that you give, because there are some treatments that you go on and on and on and on. Rather than treat you, they create problems. So it's paying attention and letting people know what you are giving them. I don't know why you have to give a sachet and put it in that plastic thing. It doesn't make sense. People don't really know what they're taking, and they dutifully go away. And the way the system works back home, they might come and consult me today, but tomorrow or in 3 days' time, they'll go and consult Chioma. So she doesn't know what I've written. And if the patient doesn't know, she has nothing to share with her for her to consider if there's any interactions or whatever in what I wish to write. So I think that's where professionals have to wake up a little bit and let people know what treatment you're giving them. Believe it or not, I had somebody recently who has had diabetes of over 20 years back home in Nigeria, and has what was a good going, or had what was a good going hypoglycemic episode at home. He was admitted into hospital, and 2 weeks later he was still in hospital. And it's like, what are you doing there? Didn't you know that if you're on insulin, you can have low blood glucose? And the type of insulin you take, there are measures you put into place to help you prevent those, because those are the side effects or adverse effects of insulin. Nigeria is hot. Africa is hot as a whole. Therefore, insulin is a lot more sensitive in those climes. Therefore, you should be well educated on the side effects you get from insulin, because it will be so active. And that's when you have hypoglycemia. Why are you giving somebody a bed for 2 weeks and they're paying? Because they had a hypoglycemic event at home that you should have told them in the first place. Drink Coke and have biscuits. That's as simple as that. So those are, I mean, it's a good going case actually that people don't know. And this is 20 years of diabetes and didn't know that hypoglycemia was a side effect from insulin. And this is his Novomix 30 and didn't even know this is how to treat it. So that is where the professionals should come into being and let people know, it will create less work for you, I hope. But it's just all monetarily driven to a large extent because of the economic atmosphere back home. But please, it's all down to education. Enlightenment, education, share those information. Yes, it will take a while, but if we are consistent with the information we share. And one thing that helps this part of the world as well is what we call guidelines. So that these guidelines, the big umbrella organizations come up with guidelines. And what it essentially means is that if you go to Chioma's setting, she will treat you in the same way as in my setting I will treat you. If they go to your setting, that's how you treat them. Rather than, I decide to do this. Because those guidelines, once we agree it and rectify, we are then sure that across the board, wherever the patients go, they'll receive the same treatment. And it helps us learn as well and makes the patients understand their journey better. So that's one thing I believe professionals back home should consider. Writing those guidelines, oh my God, for the life of me, I shouldn't say this, but even if it's out of date, but it's better than just making it up as you go along, which is what happens.
I suppose another thing I would add there would be, as the patient, you would have what you call your family doctor, who you would go to. And then it's then up to that family doctor to know their level of competence, knowing when to refer on, knowing when I need a kidney specialist here, I need a liver specialist, I need an eye specialist, and refer on to that specialist for more proper targeted management than trying to be jack of all trades.
Yeah.
Nobody would know it all in medicine. No. Even in eye, you have a retina specialist, you have a macular specialist, you have a lens specialist. It's different. Yeah. Even in orthopedics, you have a shoulder specialist, upper arm. That's all. They're orthopedic surgeons, but all they do is upper arm. You have another one. All they do is knee or hip. You have to specialize. The body is so complex that no one person will know everything. Yes, you have an overview. You have a broad knowledge, which is what I have, a broad knowledge. But then it gets to a point where, oh no, this is me, I'm done here. That's, again, something that we need to look into. So, yeah.
But what is really the cause in Nigeria? Does it mean that in Nigeria, the type of medical school they attend do not have?
No. I don't think it's the medical school. No. It's the postgraduate level and above.
Yeah.
It is the government. I think I was reading something a couple of days ago about house jobs and something, and the government, some stupid idiot, excuse my language, some stupid idiot somewhere just comes up and puts up, this is not going to happen again, house job. There's this discussion about they should not.
Why is it not going to
They are
happen
not going
again?
to afford house job. Do you think that you come out of medical school,
You
you're a
can't come out
doctor?
of.
You come out of medical school. I left medical school 100 years ago. I'm still going for courses. I'm still updating.
Yes.
And you
Yes.
think that somebody just comes out of medical school because you're in a government office?
Wow.
Of course, you're not even supposed to be in the government office in the first place.
Wow.
But because you find yourself there, there's something I read very recently
They're going to stop.
about stopping house jobs.
How do you then specialize?
How, you think you come if from reading Grey's Anatomy, you come out the next day, you become a doctor?
Wow.
You're not. That's the beginning.
That's the
of your
beginning. Medical
job.
school
You
is
don't
the
know
beginning.
anything. In short, experienced nurses know a lot more than you do.
Yeah, because what you're reading in Grey's Anatomy is
It's
different
not the
from
same
what
as
you
in
see on
real
the board.
life.
It's
And you just
totally
think you
different.
come out, you're a doctor. Yeah.
It is, wow.
Anyway, so it's something a bit more big and strategic and a changing of mindset from top to bottom.
God, we have a lot of things to do in Nigeria, honestly. We have a lot of things, and I believe our leaders should also help us in this aspect. Yes, thank you so much, Doc. It's like we have a lot information here, very, very educative, very, very good, very, very deep, to be honest. Very, very deep. And as we from the start, we discussed about high blood pressure, we discussed about diabetes and kidney disease. We discussed today. We still touched high blood pressure, diabetes, because all these lead to kidney. Yeah, and that is why if you are watching, you will find out that there are a lot of discussion about kidney disease, diabetes and high blood pressure. And Doc, another thing I remembered now, somebody asked this question regarding to high blood pressure. You know, high blood pressure, we have the reading up and down. And when that down is, what is the normal range of the down? 120/80, right?
Yeah.
Depends on your age.
Depend, okay.
So say for an average adult, 120/70. So 120/80 is considered normal. Yeah.
So assuming that the person has normal of the upper one, that is that, whereas the lower one continues going high, what should we, is it
Still going to be treated as hypertensive, where the diastolic, that's the bottom one you're talking about, is the diastolic. So where predominantly the diastolic is above 90, then that is still considered high blood pressure. You need the same medication to bring it down.
regardless of the up is normal?
Yeah, because you've got to balance both. The top and the bottom has got to be balanced. So yeah, if your bottom is more than 90, that's got to be managed to bring it down.
If the person is continuously taking medication, but that one is still not,
Then I should question what are they taking and how are they taking it, because the medication isn't going to act on the top only and not the bottom. So it's probably the range, the dose is probably not right for that person.
Alright.
Yeah.
Yeah, that's question somebody asked in last episode. Which,
So then the medication needs changing, because if we get the medication right, it should bring down both.
okay.
So it might just be an add-on because you're talking about top and bottom. Though talking about hypertension and whatever, most times you're looking at the bottom wheel. There's this systolic hypertension that you can have, that's the top one. And anxiety, stress can give you higher numbers of the top one, but the bottom one is fine. Okay. So it's not just something you take in isolation, you look at the whole thing. And for you to make a diagnosis of hypertension, you would have serially monitored to see which direction it is. And then you start, if you're convinced it's hypertension, then you initiate treatment. And then you maximize the dose of that particular treatment. If you're not getting the desired effect and the patient is taking the treatment as advised, then the next thing is an add-on. And that's where my talk about guidelines come into place. Because if you have guidelines, as the NICE guidelines, which is the National Institute of Clinical Excellence, that is the umbrella organization. It gives you guidelines on what to do.
Yeah.
If you start on A, you go to the maximum dose of A, and the patient is still hypertensive, you add B. You maximize B alongside lifestyle changes, and the patient is still hypertensive. You don't take it away. You add on. You add C. So you grade it up that way until you achieve the desired effect. You don't chop and change, as happens in most times. You begin to chop and change and you have no clue what you're doing. And if you're not doing it right, the aftermath for the person in question is kidney damage.
Today we have come to the conclusion of today's topic, which is kidney disease and kidney failure. So, Dr. Osila.
Right, thank you very much. It's been a pleasure to be part of this journey. But my key message to everybody is, please, health is wealth. Get regular checkups. Most things are amenable to treatment. Ask your doctors, what are they giving you? What are the side effects? For the professionals, please be prepared with the side effects. You're not being challenged. Your authority is not being challenged. You're dealing with human lives, and they have a right to know what you're doing. And do share that bit of information, because that's the only way we can enlighten our people and help promote our health so that people live longer and more fruitful lives rather than in agony. It's a pleasure.
Wow, I don't know how to thank you both for this amazing show, helping people and giving them information they need regarding to their health. You are not paid, but you brought out your time because you have that heart to help people with any information they need regarding to their health. As she said already, or as they said already, knowledge is power. Information is also power. Health is wealth. Health is wealth. Take ownership of your health. If you are healthy, you have everything. It does not matter how you look outside. What matters most is your health, which is inside. So regular checkups, medical checkups, eat healthy, do exercise at least. This will help you with your health. As we are informing you, we are also helping ourselves. And yes, that is all the mission of Let's Talk About Our Health and Well-Being. We are here to help every one of us. We need that information to take good care of our health. There is something we are introducing. As time goes on, we will introduce those things to help our people at home. And we'll see in our next episode, we'll introduce that. So be attentive, subscribe, and always like our program. Ask any question, then we'll get back to you. the amazing doctors. They are here to help, and they are very happy to help with any medical or health issues. Please, thank you so much and have a wonderful evening. Bye.